Tashi Delek, in today's episode of In Conversation with Tibettv, we are going to discuss very important topic on women's health. A woman's body goes through many changes during our lifetime, both physically and emotionally, from puberty, start of menstrual cycle, giving birth, and during menopause, also known as end of menstrual cycle. Menopause is often considered complex to understand, and many menopausal women felt shame related to their menopause symptoms, and there are large stigmas associated with symptoms. Let us try to understand more on menopause and how it impacts women's well-being and health in general. And for that, we are honored to have one of the leading gynecologists from India joining us in this conversation. She's based in Mumbai, an academic, author, and women activist. She's the founder president of the PCOS Society India and promoter of girls' and women's health and infertility in India. She is Dr. Duru Shah. So happy to have you on our program. Welcome.
Thank you very much for having me. Thank you very much. I'm happy to be here.
So to start with, can you explain what menopause is and what age women typically experience it?
Every woman needs to reach menopause one day. And every woman reaches menopause at different ages depending on her ethnicity. So in short, in India, women reach menopause anywhere between the age of 47 to 48 years. Whilst if you look at the UK and you look at the USA, probably the menopausal age is much higher. It's around 52, 53 years. So there's an age difference of almost 5 to 6 years between different ethnicities, you may say. I'm not sure what the menopausal age is in Tibet, but it may be closely matching Indian ethnicity, I feel. So you would be able to tell me at what age menopause is reached in Tibet.
I don't have any specific idea about that. But what are the common symptoms and early signs of menopause that women should be aware of? As you are expert in this field and you have, I'm sure, a lot of research and you have a lot of talks regarding this subject for many years.
So menopause is actually, we define it as when a woman stops getting her period for 1 year or more. Only then we say that a woman has reached menopause, and that is also in a woman who's an older age group, say in the 45 plus. Before you reach menopause, your symptoms start about 2 to 3 years earlier. And those symptoms are really very varied symptoms. There may be symptoms like usually hot flushes. A woman is sitting in an air-conditioned room and suddenly she breaks out into a sweat. She's feeling very hot. And usually it is all over the face and the upper part of the body. So that is what you call hot flushes. And that can happen anytime in the day. There's no way of saying when it will happen. But in short, it usually happens when the climate is very hot. If she's having a lot of hot drinks like tea and coffee, or if she's out in the sun. But in a woman who's living even in a cold country, she can still get hot flushes when it's very cold outside, but she's feeling hot. It becomes embarrassing for these women when they get these hot flushes, but these usually happen about 2 to 3 years before you reach menopause. The other symptoms are like mood changes. A woman's moods she suddenly get very irritated. She's angry. Sometimes she's depressed. She's anxious. There are all kinds of things. She's got brain fog. She can't think straight. Women who are into careers are the ones who are most affected because they cannot focus on on what they are doing. They don't sleep well at night because during night they get night sweats. They are very comfortable in an air-conditioned room. They're sleeping with a blanket, and suddenly in the middle of the night they start sweating. They take the blanket off. They're feeling hot, and they make the air conditioner even, the temperature even lower. So the usual person who suffers from it is the husband, because she's either increasing the air conditioning or she's lowering the temperature. The reason is because she's either feeling too hot or then she's feeling too cold. So in short, these are the commonest symptoms that she has. And of course, women who are sexually active, they feel that they don't feel like having sex, that their desire changes. They get a little bit of dryness in the vagina. They may feel uncomfortable, they feel hurt, they feel that it's hurting. And that's another problem which occurs. And the other things are, more of, emotional, the depression, the anxiety which goes with it. The last thing is that they feel that they're putting on weight. Most of the times, it's not really putting on weight. It's just that the waistline, which is usually narrow, and the hips are bigger, the waistline tends to disappear. There's a relocation of fat, or a redistribution of fat from different parts of the body, and it all comes onto the waistline. So a woman who's got a figure like this becomes like this, and she gets very upset about it because she thinks she's putting on weight, and actually it is only redistribution of fat. Periods get irregular. She may get delayed periods. The periods will gradually become scanty, and one day the period will not just come. But there are a large number of women who may get periods which suddenly become very, very heavy, or they may become 6 weeks late and then bleed very heavily, or they may get their periods on time, which they bleed heavily, or they may get erratic periods. They are constantly, stopping, starting, stopping, starting, bleeding. So there's a different menstrual pattern which shows up. But what is normal is that the period starts coming later, and it starts getting scantier, and over a period of 1 year and 2 years, the period disappears. Once the period stops coming for a year, then we say this is menopause. That is what really is menopause, and perimenopause is before that, and even the 1 or 2 years after the menopause, all these symptoms may continue. So these are the things which happen to a woman, and these are the common symptoms. Unfortunately, most of these women end up with different physicians. So like some women who don't sleep well at night because of all these hot flushes, they are not sleeping well at night. They end up going to the neurologist or someone, to a sleep specialist, so that they can sleep better. Some of them get these hot flushes, so they are going to a physician to find out why they are getting these problems, or an endocrinologist. Sometimes they have palpitations, like they can feel the heart beating fast. In that case, they go to the heart specialist. But it is simple thing is that the estrogen hormone in the body of a woman, when she's reaching menopause, is going on gradually diminishing, because the ovaries, which are the organs which produce the estrogen, are now aging, and the estrogen hormone which they are producing is becoming lesser and lesser and lesser. And all these changes are occurring because of the reduced amount of estrogen in the body.
Can you talk a little bit more on the impacts of women's physical health and emotional, psychological health? You did touch upon many of these symptoms, but can you talk a little more detail on that?
Sure. So in short, if you see, the symptoms which they have are varied symptoms, because they may present in different ways. But if you look at their emotional health, you see that is the age of women wherein her children have grown up, they have become teenagers, they are leaving home, they are going to university. Husband is getting very busy with his career, and he's busy with, growing his career and profession. So at the age of 48, 49, when she's going through the stress of hormonal changes in her brain, that these hormone changes are also affecting her brain functioning. So these changes are then causing all the the depression, the anxiety, whatever is happening to her. And then she may cry at the smallest of reasons, because she gets lonely. It's something like a empty nest syndrome, we call it, where the husband is most of the time out, children have gone away to university, her whole life has revolved around her family, and she's got no one at home. So those women go through a lot of emotional stress and emotional some of them, as I told you, go into depression. Some people, because of depression, they start eating more, and some people are just going on putting on weight, not because of menopause, but because of eating disorders which they may develop at that time. So there is a lot of hormonal imbalance which occurs, which usually occurs in women at 3 stages of their lives. The first stage is when they are reaching puberty. So if you realize young girls, when they start menstruating and they start getting puberty, they're very moody. They're very moody, and that is the time even the mother is going through menopause. So girls between 12 and 16 are, very, very what you call, having all kinds of mood changes, and the mothers are also having mood changes. So most of the time, the fights occur between the teenage daughter and the mother. And usually, a woman also during pregnancy, when during pregnancy her hormones go up, and then after delivery the hormones crash. So when the hormones crash, she can go into postnatal depression. So these are the three stages of life where a woman has got hormones going up and down, up and down. And therefore, this is something, a stage where usually men don't have these problems. It's usually the women. And the woman feels that nobody's understanding what she's going through. So she's got a lot of emotional distress, lot of strain, and this is the time she needs support from her family, support from her husband, support from her children. But that is the time they all are out. They're not around. And therefore, we recommend to women that they must get into some hobbies. If they are homemakers, they should have some hobbies. They should join some forums. They should meet with friends. They should socialize with women around that same age. They must eat healthy. They must do a lot of exercise, which we recommend to everyone to exercise. But if they've got a hobby which they can fall back upon, a hobby like you can say gardening, painting, if you like cooking, whatever. But if your life has been spent just around your family, they suddenly feel at that stage, they feel lonely. And that is why we say they need to mix around with women their age, meet them, talk to them, chat with them, and they'll feel better. Of course, there are many therapies which can be done to help them. But my strong advice to women is that even though you are looking after your family, develop a hobby, develop something which you can do, which you can fall back upon when your children go to university, when your husband is busy. You must have something which you can do yourself to satisfy yourself and to take care of the time you have on your hands. So, this is what I think is important for women to do.
Dr. Shah, can you also talk about menopause, increased risk of other health conditions, like you have mentioned hormonal disorders and other weight gain, specifically at this age. So what are the other health issues or the health risks that need great attention?
Not too much of weight they put on. They may put on just about 2 to 3 kilograms, but it is the weight, which the fat in the body, which gets redistributed. It comes more to the waist, and that is what causes the discomfort. And they have a body image problem. They say, "Oh, I'm not looking as young as I was looking before." That also causes them emotional stress. So in short, when it comes to physical health, there are various things which happen to them. The first thing is, of course, that when estrogen hormone is in your body, estrogen hormone is present in every part of the body. It can act. It keeps your skin looking glowing and healthy. It makes your hair look good. It sort of gives you that the skin remains in a better shape. The physical health in terms of your heart is in better shape. Your bones are in better shape. The entire body responds to estrogen in a way that everything remains healthy. Now, suddenly, that estrogen hormone is getting out of her system because the ovaries are now aging and they are not able to produce the amount of estrogen she needs. So, therefore, her sexual desire goes down. She gets a lot of discomfort during intercourse, and therefore, there is sometimes a sort of a difficulty with her husband. It could cause marital disharmony because the husband is keen to be sexually active while the woman doesn't want to be. So these are the areas where she's having a problem. She can pick up, a lot of vaginal discomfort during intercourse, and therefore she doesn't want to have it because it hurts. The vagina is getting dry. There's hardly any moisture there. So because of menopause, she's remaining dry. She starts getting discomfort. Then the other thing it can cause is a problem on her bones. You see, a woman loses, bone after the age of 35. She starts losing bone. in a little bit of a small percentage every year. But once she reaches menopause and estrogen is out of her system, the bone, she starts losing bone at a higher percentage than she was losing before menopause. So most of the women after the age of menopause, they find that their bones are getting weaker. And if they do a bone density scan, they'll determine how much of bone they're losing. On an average, 1 out of 3 women, by the time they are 65 years of age, they have had a fracture. And once they have a fracture, then if it's a hip fracture or it's a spine fracture, it causes a problem with, they get bedridden, they are going through surgeries, they are going through various disabilities. And as they get older and as the bones get weaker and weaker, they develop osteoporosis. And when there's osteoporosis, you might have seen women, who get bent like this because the spine starts getting, the bones start getting soft. So therefore, they start collapsing on each other, and then the body becomes like this. So this is something we want to avoid. We want to prevent all these deformities. We want to prevent fractures of the spine, the hip, and the arms. And these are things which is causing a lot of disability, and it causes more mental anxiety and stress to a woman. So physically, osteoporosis is one of the results of deficiency of estrogen. Second is the sexual function gets affected. Third is that the urinary system is very close to the vagina, and therefore, because of the lack of estrogen, a woman is easily infected. She can get a higher risk of developing urinary tract infections. So she can develop urinary tract infections because when she's sexually active and the urinary system is very close to the vagina, it can pick up an infection. Just like it happens in a girl who's newly sexually active. Previously, we used to say newly married, and therefore we used to call it honeymoon cystitis. Means on your honeymoon, you pick up an infection of your urinary bladder. But today, girls are sexually active much before their honeymoon. So we don't call it honeymoon cystitis. But during the sexual act for the first time, she's got a higher risk of developing urinary infection, especially if the partner has not used a condom. So urinary tract infections can come up, sexual dysfunction can come up, osteoporosis, and then at this point in time, she also starts accumulating a lot of fat in her abdomen, which then gives rise to high cholesterol, diabetes, and all this can then finally lead to cardiac problems. In a younger woman, if you see between the age of 40 and 50, if you compare women to men in the age group of 40 to 50, you will find that not many women have a heart attack. It's usually the men who have a higher risk of a heart attack between 40 to 50. But when a woman grows older, goes beyond 50, you will find her risk of a heart attack almost matches the same as that of a man. And therefore, we say it's that estrogen in her body which was protecting her and giving her the protection which she's not having any longer now. So that is another fact we have to keep in mind, that she develops non-communicable diseases which occur as commonly as men have post-menopause. So these are the various physical issues she can have after she reaches menopause, mainly due to estrogen deficiency.
Dr. Shah, so I like to say, as a woman, I always felt woman's body, it's like we have this biological clock, right? Starting from her birth, and then from a start of a menstrual cycle, every month we have to check and everything. And then comes the menopausal, where a lot of things that we need to understand. And I know it's difficult, it might be difficult, because you have shared so many symptoms that women have to manage. So can you talk to us a little bit more on the effective ways to manage menopausal symptoms?
Yeah, so normally these menopausal symptoms are, we say, do exercise, eat healthy, focus on something some kind of a hobby or focus on your career. But I'll be honest with you, however much women try doing all these things, it's not easy to control it. So what we say is that for hot flushes, wear layered clothing. If you're in an air-conditioned room where you're feeling hot, you can take off the layers. When you're feeling cold, you can wear the layers. But those are all temporary measures. The best treatment for this is estrogen replacement therapy, what we call, any hormone in the body. If you are deficient in that hormone, you are going to be supplementing it to help yourself to remain healthy. So here we are talking about giving hormone therapy or estrogen therapy to women who are having estrogen deficiency. And all these symptoms, if they are not getting controlled by doing exercises or yoga or meditation or whatever we ask them to do, and if it doesn't help them and they're not sleeping well, they're not having a good quality of life, then it's a good idea to offer them hormone therapy, which is very good for them and keeps them as bright as ever, and it makes them feel as good as normal and just like they were feeling before menopause. So that is something we offer to our patients. And of course, we have to select the patients right. We have to investigate them, make sure that physically there's no contraindication, there's no reason for us not to offer them hormone therapy. We do all that history taking, examination, testing. We make sure it's safe for us to give it to them, and then we give it to them. Now, in women who are going to take only estrogen, we have to supplement the progesterone, because otherwise, if they take only estrogen, then it will act on the uterus and it will make the lining of the uterus get thicker and thicker, and one day they'll start bleeding. So, in short, when they start bleeding, or they can develop cancer of the uterus if they take only estrogen. So, if a woman has got her uterus intact, it's not removed for any other reason, then she needs to take estrogen with progesterone, which is very safe. Women take it for years together, but of course under medical supervision, and they continue taking it. There are many other products which are similar, but every product is given for has a different way of working. So depending on what will work best for a patient, whether we should give it oral, whether we should give it transdermal through the skin, or whether we should give it as an injectable, or whether we should give it as a vaginal product or as a spray. There are different products available in different countries. In India, we don't have the patch available to us because it came into the country, but because of the excessive sweating and humidity, the patch would come out. Normally, the patch is worn for 4 days at a time, and then you replace it with another patch. But in India, we don't get the patch any longer because it didn't work well for us because of the sweating. But otherwise, a patch works beautifully. You wear the patch on your thigh, you get a 4-day patch, you get a 7-day patch, you get an only estrogen patch, you get an estrogen progesterone patch. People who have got problems with their liver, then they would rather not take oral tablets. Those who have got excessive amount of cholesterol or triglycerides in their blood, they cannot take it orally. So there are, pros and cons of how we offer the patient, what we offer, and how much we give them. We try and give them the smallest dose which they require to relieve them of their symptoms, and that is what really helps them. So we adjust the dose according to the needs of a patient.
Okay, and Dr. Shah, can you briefly also tell us what are the any non-hormonal treatments or lifestyle changes that can alleviate menopausal symptoms?
So as I told you that if we cannot give, say, hormone therapy to a patient, or if she's not willing to take it for whatever reason, then in that case we would give her, sometimes for her symptoms we may use products which are SSRIs. Like, these are the products which really work at the brain level, and they help the patient to remain symptom free. So those also are equally good. We can give it to them, not that we can't, but again, they have to be under medical supervision. A woman cannot just buy a tablet from the pharmacy and take it. So that is something which she can do. And even if she doesn't wish to take it, you have to explain to a patient that this is temporary. It's going to go on for a few years. And if you're comfortable, without it, that's fine. You don't take it. You just follow the simple instructions as I have mentioned earlier. do exercise, don't take hot drinks, etc., coffee, tea, cut down on it, have more of, wear clothing which is, sort of in layers, um, do some, sort of activities, keep yourself busy with something, some kind of activity which you would like to do, enjoy doing it. That's what you should do. So, lifestyle changes is eating healthy, doing exercise. That's extremely important.
And also, can you talk to us about what is the most important misconception about menopause that you have encountered in your practice over the years?
So if you see, in India, menopause is welcomed by most of the women in the rural areas, because in the rural areas, the women are working hard, working in the fields. They get upset with all the heavy bleeding sometimes. And as a matter of fact, because of the heavy bleeding, they go to the doctor and say, "Take out my uterus. I don't need this. I don't need this." And they think that if you take out the uterus and you're not getting your period, they think it's menopause. But that is not menopause, because the ovaries are producing the hormones, and the hormones are there in their system. But they are happy when they get the menopause, because they feel it's a relief that they have stopped their periods. But in the urban cities like in Mumbai, where I am, if a woman reaches menopause, the woman feels that she's getting old. She feels she's going to lose her beauty. She's not happy about it, and she's very upset. So those women are the ones who are happy to take the menopausal hormone therapy, because in the past, menopausal hormone therapy was unfortunately labeled as a ageless therapy. Like if you take it, you will never become old, sort of always remain young. And that is the time, many years ago, when hormone therapy was given to every woman when she became menopausal. It was not, the women were not selected, the women were just given it arbitrarily. And therefore, at that point in time, they saw certain cancers coming up because of the hormone therapy. So today, when I offer hormone therapy to my patients, most of them don't want to take it because they are scared they are going to get cancer. That is one of the biggest myths we have, because people are only thinking of the negative things of hormone therapy rather than looking at the positive things which happen. See, as it is, it's understood in public life, okay? When you have a story on the newspaper which is negative, people tend to read it more than a positive story. So, in short, women tend to think that if they take hormones, they are going to get breast cancer or they are going to get some cancer, which is not correct. That there may be chances in some women of a higher risk, but therefore, if they go to the doctor, the doctor selects the drug right for them, monitors them, then there is no issue, and it should be, on the contrary, giving them a better quality of life, and that is most important. Of course, we say that hormone therapy ideally should be given for as short a time as needed for the symptoms, but there are many women who continue it, and they say it is pretty safe if you take it for about, say, 6 to 7 years after your menopause, and then you may gradually taper it off after a few years. But the other myth we have is that with the menopause, your life has come to an end. Now there's nothing you can do about living healthy or living normally, and that is something again which is a myth, because today 1/3 of our lives are spent after menopause. Previously, women used to die most of the times in childbirth because of sepsis, because of infections, whatever. They hardly lived much beyond the age of menopause, so nobody knew what was going to happen. But in today's days, because of medical treatments being better available, women are living longer and they become more productive if they are in a good health. So, in short, after the age of 48 or say even 50, if a woman lives till the age of 80, she's got 30 years of life which she's got to lead, and she can easily lead it very happily, very physically, content, rather than thinking that, oh, my life is over because I've reached menopause. That's a negative way of thinking. So I think that's another myth which is existing, that after your menopause there's no life. So that's again another myth which exists. So these are the common myths I find in my practice, which are There, are you aware of anything which goes on in your part of the world?
Not very much. So coming to my next question, I like to ask, what advice would you give to women who are just starting to experience menopausal symptoms?
Mhm. So when they are having the symptoms of menopause, if they understand why those symptoms are there, I think the best thing for them to do is to go to a menopause specialist or meet the gynecologist, find out, what they can do, and then accordingly do what the doctor tells them. Of course, we also offer them a lot of calcium, vitamin D, especially in countries where, people are not exposed to the sun. But in India, we have so much of sun, but still we are all deficient in vitamin D because we are hardly out in the sun. We are more inside the house, inside the offices with their air conditioners on. It's too hot to go outside. So, in short, we give them all the advice which we want them to give, that see your doctor anyway, have a health checkup once a year. You need to make sure that you're not having any other issues, like say we request them to have a pap smear, we request them to have a breast examination, make sure that there's nothing going on in the breast, early signs of cancer to look for non-communicable diseases, like get your blood pressure checked, get your cholesterol checked, get your sugars checked, make sure that you're not developing any diabetes, osteoporosis, all the problems which occur with postmenopause. So I feel every woman, what I would recommend is that what we find in our country, that many women, once they have had their babies, they don't go and see the doctor. Then they go and see the doctor only when they have a problem, or their gynec. They go only when they have some after menopause they start bleeding. Then they go and see the doctor. Or if they've got heavy periods, they go. But if they are normal, they don't go. And then the tests are not done, which are needed to be done at that age. We have to do tests to determine whether there is any early signs of cancer coming up, if there's any early signs of osteoporosis happening, or if there is high cholesterol, if there's high blood pressure, anything. We need to have an annual checkup once a year with the doctor, even though there may be no symptoms. So, my suggestion is that if there are symptoms, of course, you see the doctor with your symptoms. And if the doctor takes a proper history, the doctor will know that this is because of approaching menopause. But there are women who are younger, by the age of 30, 35, they may lose their periods. And that is called premature ovarian failure, or it's called premature menopause. And that is something where it affects their life tremendously. There is where we expect them to take the hormone therapy at least till the natural age of menopause. We actually, as doctors, guide them to take it, because otherwise they are aging much earlier than their other counterparts. So, if at 30, 35, a woman loses her periods because spontaneously, not because she's removed the uterus, but she reaches premature menopause, then she needs to be taking hormone therapy after seeing her doctor, who will examine her, who will do all the tests, and ideally should take the hormone therapy to live in a better quality of life and to avoid aging at a very early age. Of course, if she needs children, she needs to see the fertility specialist, and they will help her with helping her to get pregnant. So that can be done also.
This question might sound a bit similar, but before signing off, I'd like to ask, how can women best prepare for the transitioning into menopause?
See, I think it's something which you most of the women don't even. I'll be honest with you, they don't even think about it. At least I'm talking about in our country, where transitioning into menopause is something which they are not prepared for. I mean, they, even though they know they will reach menopause by 49, 48, 50, there's nothing special they do. The only thing some of the women do who are educated on the subject and who know what can happen, they start going to a physical fitness center, they start working out in the gym, they start doing weights, they start doing some form of exercise, they start eating healthy, they get into hobbies, they start doing that. But there are a small percentage of women who are doing that. And I would also strongly recommend that they should do this, because many women get so involved in their own families, with their own children, with their children's education and their homes, that they neglect themselves. I think it's important for every woman to devote at least 1 hour of her life, of her day, to herself, so that she can have time to recuperate and to build herself in a positive way, so that she's in good health. A bone has got enough, is strong enough, her muscles are strong enough, because as you age, your muscles get weaker, your bones get weaker, everything is getting weaker. For mental health, see, as you get older, you may also develop dementia, Alzheimer's, whatever. But the question is, if you start doing the brain exercises, all kinds, physical, mental, all the exercises, you can be in a better shape to go through menopause quite happily. There shouldn't be a problem.
So, Dr. Shah, these are my questions for today, and it was lovely talking to you. This conversation has been very informative, and I bet we have to start creating more awareness on menopause and starting a whole new discussion on this topic, and especially in our community, it's also needed, I felt. So, thank you so much for talking to us, and thank you so
Thank
much.
you. Thank you. Actually, we have quite a few of myths and facts. We have pamphlets through the International Menopause Society. And I think we have shared them with you, if I'm not mistaken. You could translate them into your own local languages and give it to your women at your community. You can also translate whatever I have spoken into your local language and transfer it to your community. We are also happy to, if people speak Hindi in your area, we have the doctors who can speak in Hindi and explain different things. So we are very happy to do whatever we can for women in this world wherever they are.
With this, we have come to the end of today's program of In Conversation with Tibet TV. Thank you so much for watching.